Can you guys believe it has been 2 years since my tummy tuck? In today's video, I wanted to give you guys a really honest 2-year update on my tummy tuck, how I feel in my body now, what I've learned, if I have any regrets, as well as answer some of your most asked questions. So if you're new here or you haven't been following along my journey so far, my name is Anna. I'm a 37-year-old mom of 4 and I had 5 pregnancies in 6 years. So my body really didn't get a chance to recover. My biggest baby was my last one and I was left with a 3-finger separation and diastasis recti, which is where your stomach muscles basically split apart. I had consultations with doctors, physiotherapists, and basically was told that no matter how much I exercised or what I did, I would not be able to fix those tummy muscles naturally. So in 2023, I went to see a plastic surgeon and we talked about options for a full ab repair, which is exactly what I got. He also did a breast lift because my breasts were very, very low and saggy since I breastfed all 4 of my babies for 12 months each. My boobs basically look like empty sagging socks. I opted not to go with implants. My plastic surgeon didn't tell me what to do, but he pretty much was recommending that I don't do the implants. He ultimately left it up to me, but he was very honest with me about complications that could happen from implants, breast implant illness, and how a lot of his surgeries that he does now are actually where he removes breast implants. After I had done my own research and kind of just had to think about it, I decided that implants were not for me. And this is no judgment to anybody who has implants. Like I personally think they look great. And sometimes I do think like maybe I should have had them done, but it just wasn't the right decision for me. So I opted for the fat transfer and a breast lift. I'm really happy with how high up they are now. I'll talk about the fat transfer in a little bit in the video. So that was ultimately why I decided to do the surgery. I did wait until my youngest was 5 to do the surgery. I have 4 kids. Their ages right now are 12, 11, 8, and my youngest is just about to turn 7. So when I did the surgery 2 years ago, it was like 5 days shy of his 5th birthday, and I would definitely recommend waiting. I've talked about this before, but if you have young kids, I would definitely recommend waiting that long. I feel like 5 was a good age because he wasn't being picked up anymore and stuff like that. So let's get into how I feel 2 years later. The most commonly asked question is, are you happy with the results? And the simple answer is yes. It's like an all-round yes. I am so happy with the results. I would do it again and again and again in a heartbeat. I feel like as a mom, this surgery gets judged so much for being selfish, vain. I don't see it that way. I really don't. I feel like if you broke your arm and you had the option to repair it and have it go back to how it was before the accident, of course you would take that opportunity. And I feel like it's the same thing with a tummy tuck, especially with women who have given birth multiple times back to back and their stomach muscles have literally ripped beyond repair. It's a no-brainer. I feel like it's the least vain thing actually. Of course there's aesthetic reasons and I fully admit that I enjoy the aesthetics of it as well, but it goes so much deeper than that. Another question I get is, has your body changed or settled since the 1-year mark? So I get this question both about the fat transfer in my breasts and also the tummy. So I'll show you at the end what my stomach looks like. It's definitely changed in the sense that my scar has faded significantly. So I don't even really see it anymore. It's still there, but it's very, very, very faded and I really don't notice it anymore. I still have a tiny bit of, I wouldn't even call it numbness. So when you first get it done, you're numb around the area that got cut open basically. Now I do have feeling like everywhere, but I would say there's one section where it still feels, I can feel it, but it's not as, I can't feel it the same way I can feel everywhere else, if that makes sense. It's like a little bit duller of a feeling. Like I can still feel it, but it's not numb, but it's kind of dulled. My fat transfer, my doctor did tell me that you lose, I think it was 60%. I can't remember. I'm so bad with numbers, but I think he said you lose up to 60% of the fat. So in the beginning, my boobs looked incredible. Like they were basically back to how they were pre-babies, which I had like a full C cup size. Now I think I'm more of a B. I actually need to get measured and like get some new bras because they're all too big for me. So yeah, my boobs have definitely gone down. And I talked about this at the 1 year mark. I think they've gone down even a little bit more, but that is probably because I've been weight training. So I have put on muscle and probably lost a bit of body fat. And the one thing that they say to you before you get your surgery is, are you maintaining your weight? Are you at a stable weight? Do you want to lose or gain weight? I answered yes, because I had maintained that weight for about 2 years at that point. So I really didn't think it was going anywhere. Even with the tummy tuck, you really don't want to fluctuate too much. Obviously a little bit of weight loss or weight gain is okay, but you really do want to stay around the same range that you were when you got the surgery done, because it can affect the results and it can stretch things out or create some loose sagging skin if you go a lot smaller. So you do want to be kind of at maintenance range. And it can also affect your fat transfer, of course, because when you lose body fat, at the end of the day, it was my own fat that was injected back into my boobs. So when I lost body fat, of course, it just goes for, you can't choose where it goes from. I'm going to talk about weight and numbers here. If anyone gets triggered, maybe skip this part. But before my surgery, I went in at about 61 or 62. I think I was 62 kgs. 1 year later, I was 58. So I lost 4 kgs, which isn't a lot. And I do think a lot of that was probably like the loose skin and probably fluid as well. I will say as well that when I went in to have my surgery, my weight was a little bit higher because we had just come back from holiday. Now 2 years on, I've actually lost another kg, but I think that's because I've done a lot of weight training and I've lost some body fat and gained some muscle. I've been working with a personal trainer. I've been weight training a lot more, eating more protein, and I think that's just what happens. A lot of people ask about clothing, like how does clothing fit you now versus before? My clothing size is pretty much the same. Like I wouldn't say that it's drastically different, but obviously clothes do fit different, as in around the waist, right? So my waist size has got a lot smaller, but the rest of me hasn't. It's more so just my waist. I will say it has given me my pre-pregnancy shape back. So before I got pregnant, like ever, I always had a really small waist compared to my hips and bust. It was like a good 10 inches smaller. And then I kind of lost that after having babies because it does thicken out. And I became more of a rectangle, whereas now I'm more of an hourglass again. So that's been really nice. I will say, just from an aesthetic point of view, just being completely honest. Talking about my workouts, my fitness, my lifestyle now, I think this is a really important topic because this is one that I didn't realize how much it would be affected by the surgery. So I didn't even think about the fact that the diastasis recti was putting so much strain on my back that it was giving me backache, but I didn't even know. Like I just kind of dealt with it and didn't even realize, because of being so severe, I would always just suck in. But the problem is, if you constantly suck in, you kind of give yourself a bit of a tummy ache, but it also puts pressure on your back to be constantly like constantly sucking in and conscious of it. And I was really conscious, especially after I'd eaten a big meal. It would just stick out and I would look 6 months pregnant. And then I would be really conscious and keep trying to like suck in, but like unnaturally so, you know, all the time. And it was giving me this aching pain around my back. And I didn't even realize it because I just thought of it as normal. It just became my new normal. When I had it fixed and I realized that I didn't have to constantly suck in anymore, I can't tell you what a relief that was on my whole, it was like my whole nervous system just relaxed. And that was just a huge weight off my shoulders, and one that I really didn't expect to happen. I've been able to take my fitness to levels that I was never able to before. I've been able to train my abs and my core in ways that I never could have before and see the results as well. Like it's incredible to, you know, before I would work out 5 days a week and never see any results in my abs or in my stomach. Whereas now I put in the work and I can see the results. And that's been really rewarding. And I don't care what anybody says. I think if you work out and you take care of your body, of course you want to see the results. And then I think I've kind of answered this one, but would I do it again? Yes, of course. Hands down, I would do it again 100 times over. If you haven't watched my 1-year update, please watch that, because that's got all the things that, like the advice about kind of the specifics. And I go into things like childcare and getting some help during that time frames of when you start to feel good and start to feel more like yourself. So definitely check that out. This video is more just like a 2-year review. Let me show you guys what my stomach looks like now, although I kind of feel like you guys know because I do show it a lot on here, but I'll show you guys. All right, so this is what it looks like 2 years later. Obviously I've got like a bit of creasing from my jeans, but hopefully you can see. And then this is the scar. So I can't really see what you can see, but hopefully you can see it. So you can see, I think I showed in my last one, I've got some stretch marks here. So this was my old, like, so basically they pull the skin. So my old belly button was like down here, and then they pull the skin down, they make a new belly button. I had stretch marks all around my belly button, and so they're down here now, but you can still see them. And if I kind of like bend over, you can see them even more. I don't know if you guys can see that, but that's the scar. So it's hip to hip. So let me see, it starts here and then it ends here. That's a crease from my jeans, but right there. And that is what the tummy tuck scar looks like. Hopefully that answered some of your guys' questions. If you are considering a tummy tuck, or if you're going through it right now, hopefully this video helped you and gave you a little bit of hope in the years to come. It is 100% worth it, and I would recommend it to anyone. If they can afford it, like, I would just say go for it. It is major surgery, but it is so worth it. I hope that this video answered some of your questions if you had them, and if you have more, just leave them down below. I'll try and get back to as many as possible. Be sure to subscribe. I upload 2 times a week, and I will see you guys in my next video. Bye.